This is a recording of this year's Virtual Residency Fair. We'd like to take the time to thank the programs that volunteered their time to present to this year's applicants. This year's PM&R Scholars Virtual Residency Fair is supported by PM&R Recap and Ultrasound Guidance. PM&R Recap is the leading resource for your physiatry board preparation, clinical preparation, audition rotations, and beyond. PM&R Recap offers 35 hours of review videos, hundreds of review questions, and oral board cases to help you become the best physiatrist that you can be. Head to pmnrrecap.com to learn more. Ultrasound Guidance is the innovative new online ultrasound learning platform that gives you instant access to expert instruction. With rapid scans and complete scans of every joint and peripheral nerve, Ultrasound Guidance is the perfect way to jumpstart your MSK ultrasound learning. Visit ultrasoundguidance.com to learn more.
Can everyone see that okay?
Yep, we're good to go.
Great. Well, my name is Tony. I'm one of the chief residents here at Baylor University Medical Center at Dallas. I have my co-chief, Yi, on the call as well, but I think he's going to be quiet for most of it just because he's driving right now. So thank you for letting us present this and letting us have some time to talk to you about our program. It's going to work. All right, there we go. So I know we only have kind of a brief time, so I want to hit some of the major highlights at least. So we're Baylor Scott under Baylor Scott White Health, no real affiliation with Baylor College of Medicine down in Houston, but we're also affiliated with Texas A&M College of Medicine. Total, we have 9 residents, so that's 3 residents per class. We do have the intern year included for some of the spots. I think the details of that are still trying to be worked out, but we most recently had our first 2 interns that will be at the Baylor facility campus in Fort Worth. But mainly it's the 3 residents, advanced program mainly. We have about 23 board certified faculty, very open door policy. You're able to approach any of the faculty here. This is kind of an older picture just because of COVID, so they haven't had too much time. Overall, the structure is very much inpatient heavy at the beginning, and then you'll have call basically throughout your 3 years, but they start to kind of dwindle down from 9 weeks, 6 weeks, and 2 weeks, 1 week at a time. It's home call. So you're at home most of the time, and then you just go in on the weekends to do admissions, and then you're on call after 5 p.m. on the weekends. So very balanced training. I think we actually have a pretty strong inpatient training from what I hear from other programs. And we'll talk about that a little more later. The outpatient rotation is kind of spread throughout the Dallas-Fort Worth area. So if you're not familiar with the area, you could be driving upwards to an hour in some days, but you're usually not splitting sites. But it's a good opportunity to just see how different practices work. And they're all willing to teach. They're all happy to have you there. And another big thing, I don't know if we'll get to this. Yeah. Another big thing is that our program is not resident run since we only have 9 residents. So a lot of the services actually are used to not having residents. So, there are some benefits to that. I think one of the biggest ones is when you want to take vacations, it's really between you and the attending physician. So they don't mind if you're not there, if you're sick, or you have to make a doctor's appointment. It's not a huge deal. They're pretty okay with you taking off as long as you give them enough notice. And that also means that when we do take those vacation days, you don't have to coordinate with your co-residents to figure out who's taking your call, taking your pager, things like that. We have a really structured didactics every week from 7 a.m. to 12 p.m., about 5 hours every week. It's protected time. So that means actually Dr. Hamilton, you can see her. I don't know if you can see my mouse, but she's over there kind of kneeling down in the photo. She actually takes our pager if it goes off so that she covers our calls if we get paged during that hour. But most of the nurses know not to page us during our protected hours. So that's pretty great. We get about 2 months total of selective rotations. We say selective, but they're more kind of open-ended, and you can tailor them to how you want. A lot of our outpatient rotations, and your selectives can be like this as well, are catered for us so that every day you may be with a different attendee, or every day you may be doing something different, because we're trying to maximize our opportunity and our learning experience. So if you're on rotations that have a lot of procedures, we find a way to schedule your days with the physician when they're doing the procedures. That way you're not spending a lot of time in clinic when you're getting that experience somewhere else. So you can also model your selective rotation that way, as well as making time for research. We have a very large research department within the rehab building. They do a lot of cutting edge research, a lot of vagal nerve stimulation research currently, and then they're also very willing to help us whenever we have our own projects. I know he's doing a big project right now with some more retrospective data. We're also part of the model system for TBI and spinal cord injury. So my project's been working with traumatic brain injury model system, and we can talk about that a little later as well. But that just goes to show that there's a lot of research going on in-house that you're always welcome to join, or you're welcome to start your own project as well. Some other small things, we get about $5,500 for conferences throughout your 3 years, about $250 a year for just textbooks. That's like a soft 250. Obviously, you can't always hit that exact number. So, you can go up like 270 sometimes just with taxes and things like that. Free parking, obviously. Every month you get $60 that can be spent at the cafeteria, which is nice. And it builds up. So if you have a bunch of outpatient rotations that aren't on the main campus, you start to build up that $60 a month. So that can be pretty great. This is our fearless leader, Dr. Hamilton. She's board certified in spinal cord injury and PM&R. She's very great. She's one of the major reasons why I love this program. She's very approachable, cares a lot about your education, tries to make sure that you're spending your time wisely and make sure that you're getting the most out of your training. I can't say enough good things about her. She's always advocating for us and always making sure that we're getting the most out of this training as we can. So like I said earlier, I think we're pretty strong in inpatient rotations and inpatient training. It is kind of front loaded, mostly in your PGY2 year. Our main campus is kind of the Dallas Baylor Institute for Rehab campus. It's got about 87 beds. I think 92 is officially, but with nursing staff, it's about 87. We have a ton of traumatic spinal cord injuries, traumatic brain injuries, which is why we're also part of those model systems, because we qualified for those and qualify for the amount of research that we do with them. Just your inpatient rotations, you'll see a lot. The complex rotation has a lot of transplants, cancer patients, just complex medical patients. We don't do as much vent weaning as we used to, but that's not that we can't. We have that capability. It's just based on our population recently, we haven't been doing that. Most of your inpatient rotation is going to be on the Dallas campus in the rehab center there. There is like a month or so where you go to the Fort Worth rehab building, which is more like a community rehab hospital. So you get that experience as well. Lower acuity there, but it's a good training experience, especially if you're thinking about doing inpatient in the future. So kind of briefly going over our different services, Dr. Sika, she's great. She's the spinal cord injury doc. You'll work with her about 3 months and you'll see a lot of traumatic spinal cord injury. You'll coming out of training from here, you'll feel pretty comfortable with doing inpatient spinal cord injury. Traumatic brain injury as well. We get a lot of referrals from out of state and even out of the country sometimes. Dr. DeBio's pretty world renowned for traumatic brain injury. We'll also get a lot of patients with disorders of consciousness. We have a disorders of consciousness program where we take these patients, usually they're coming from LTACs, and we kind of admit them for 2 to 3 weeks and just try to re-stimulate them and try to help them recover a little bit if possible. But it's a pretty interesting experience to work with them. Complex medicine with Dr. Desai. This is where you'll see a lot of your transplant patients that come from, especially coming from Baylor's Salmons Cancer Center. We get a lot of patients from there. A lot of just very sick patients, and we'll get them early too. So you'll see very high acuity, and you'll see lots of transfers, but it's a good learning experience. Just general, Dr. Thomason and Dr. Sims. Dr. Sims works in the Fort Worth hospital, but Dr. Thomason works at our Dallas hospital. he does a lot of the hollow organ transplants, so heart and lungs, as well as the LVADs. So you'll get exposure to LVADs as well through him. Dr. Patel, you'll see lots of strokes. Obviously, it's PM&R. So Dr. Khan, you'll have about 4 months of consult service throughout your training. That's all in Baylor Dallas. Now that we're part of the model systems for brain injury and spinal cord injury, you'll see them very early on. You'll see them within the first week of their injury. For SEIs, about probably the first 24 to 48 hours, you'll see them and do the ASIA exam and see if they qualify for the model system. So it's a really good experience. And we work really closely with the neurointensivists and the neurosurgeons. There's a really good culture overall at Baylor. I don't think I've ever been yelled at by an ICU physician at all. I'm just rounding there. They're all very nice and they're all willing to teach you. So, and a lot of them are volunteer to come to our didactics to teach us as well. Our outpatient rotation. So you'll rotate at multiple different centers throughout your time here when you come here. Mainly you're going to be around Dallas area, but we have a lot of different outpatient clinics and it's all really mixed. And like I said before, a lot of your rotations every day is a little different and you'll be on that rotation for a month or so. And it really does optimize your learning experience and make sure you get the best out of all the physicians that you'll rotate with. So one of the most interesting rotations we do is with Dr. Wilson. She's actually runs an amputee medicine clinic on Thursday mornings, but on her other days, she's the chief medical officer of Baylor Dallas. And we get to shadow her basically for a month and go to all her board meetings. I think some of the residents actually sat into interviews with her when she was interviewing for new hires and physicians. And she kind of like led on like, okay, what do you think about that candidate? So that's always an interesting experience. And then amputee medicine is always great with her. She has a really good relationship with her patients as well as with Hainer Clinic. So you'll get to work with her and then work directly with Hainer Clinic to see how they do the fitting and everything. Our EMG rotation is something that's been very interesting. Even if you don't like EMGs, you'll like working with these docs. Dr. Mukherjee, he's on campus at Baylor. He's very technical. He'll teach you the right way to do it, basically right out of Preston Shapiro. And then you'll have Dr. Salah and Dr. Watkins, who are both, they're more general PM&R out in Fort Worth. They were private practice, not really employed by Baylor Scholars Lab, but they have really good relations with us. And we get a lot of EMGs out there with them. And they see lots of pathology, starting from Fort Worth all the way to kind of towards Weatherford, if you're familiar with the area. Some more general rehab with Dr. Sims. That's in the Fort Worth inpatient hospital and outpatient clinic. He just does a variety of things as well. So Dr. Hamilton, a program director here, again, you'll do outpatient spinal cord injury with her. Dr. McComlow, you'll rotate with as well. She's up in, I think, a little further north now, but you'll get tons of Botox injections as well as pump refills for baclofen pump refills. And you'll learn to manage patients outside in the community as well. Yeah. Pain medicine. So there's a lot of interest in pain medicine now and interventional spine. Dr. Wallen, someone that you'll work with who's board certified in pain. He's great. We also have Dr. Sheikh, who's anesthesia pain trained, but then he's actually willing to spend a lot of time with us and teach us a lot. So you'll get hands-on experience with those two docs, as well as Dr. Lewis and Dr. Shalanko. I don't want to spend too much time here, but pediatric rehab, we have a great relationship with Children's Hospital of Dallas. So you'll work with all their specialized clinics. If you want to do pediatric rehab, that's always an option. So we already have about 2 months built into your schedule. We have good sports medicine coverage and training. UT Southwestern, if you're not familiar with the area, they're another residency kind of down the street in Dallas. We get to work with them for a month and go to their resident clinic and kind of just power through their clinic, which is a really great experience for us. And we have good relationships with them, and we'll hang out every now and then. Let's see. Research. I think we talked a little about research. There's a lot of projects that we do out here. You're always welcome to jump onto some of the major projects as well as start your own. Our didactics every week, Tuesday, 7 a.m. to 12 p.m. We also have anatomy lab basically, I think it's almost 10 months out of the year where we get cadavers and prosection. So you get to play with those once a month. And usually those are about like 3-hour labs. So you get to learn a lot just with that. And then Sideline Coverage, we're growing that again. That's Dr. Wise down in the bottom middle at the, I think, college baseball event. Continuity Clinic, we have that. Every resident has that once a month. It's pretty great. It's like protected time, and then you get to have your own clinic patients. You only get, probably most people see about 4 a day. So it's just that half day, and you just kind of get to practice what it's like to have your own clinic. So
We have about 5 minutes left.
all right. Home call. It's always great. I'm actually on call right now. And I'm in my daughter's bedroom. So just hang out. You don't get too many pages, to be honest with you. And then on the weekend, you only do admissions, and then you cover their call outside of normal working hours. Even though there's a lot of driving, it's reimbursed. You can moonlight. And then this is just all general stuff, I think. Okay. So I guess kind of went slower than I hoped, but are there any questions I can help answer? These are our contact information. I'm Tony, and then Yu's also on the line as well.
Hi, yeah, I really appreciate how in depth you went with talking about like the attendings that you all work with, but I always ask this, is there like, do you feel like there's a certain patient population or like a pathology that you feel that your program gets a unique amount of exposure to?
Yeah, I would definitely say, especially if you're interested in doing inpatient, looking for those programs that have model systems is pretty good, because it says a lot about your program, and it says a lot about the type of research you have, because in order to be involved in it, you have to have that setup where a majority of your patients are coming from a level 1 trauma center that have this acuity, and you're able to see them, and you're able to transfer them to an inpatient rehab facility. So spinal cord injury and TBI, we have that built in. I think in terms of complexity, a lot of places have cancer. I think we have that as well. LVADs, I think, is relatively unique because I don't think all rehabs have that. So I would say LVAD exposure, just very acute traumatic brain and spinal cord injuries, and then cancer. I think those are big ones.
Awesome, thank you so much, man.
And then let's see. That's a good question I think someone asked about IMGs. That's a good question. I think they do. I don't know for sure, just because, obviously we're a small class. It's only 3 per class. I don't know how often we have IMGs. I'm going to shuttle that question to my program director as well, and then we can get back to you if you want to shoot me an email as well. Whether or not step 1 is mandatory, that's a very good question, especially now that step 1 is becoming pass fail. I don't know if that's still the case. I do know if you look at our history of graduates, a lot of us are DOs, including about half the attendees are DOs. So it's not that there's no value in complex 1. I don't know if the step 1 is still a requirement. So I'll ask her about that as well. That's a great question. I don't know how that's all shaking out anymore.
We have about 2 minutes left.
So if you messaged in the chat and want to know the answer to your questions, shoot me an email as well so that I can get back to you. And so I think this photo is a good photo. You can see there's Dr. Chu Yi over there pointing a gun at Dr. Hamilton's head. This is a paintball gun, actually. This is one of our events. So oops. All right. Any other questions that I'm missing?
All right. Well, Tony, really appreciate your time tonight. Thank you so much for taking the time out of your call schedule, especially to present on behalf of your program. I know
Yeah, sure. Of
people really
course.
appreciate that for sure.